I'm Dr. Leah Kroll. I'm a neurologist and a lifestyle medicine specialist, and one of my favorite things to talk to my patients about is dementia prevention. Now, everyone is afraid of cognitive impairment and dementia, and of course, I completely understand that. I'm biased, but as a neurologist, I think that your brain health is just about the most valuable thing that you have. I think most people have been touched by someone in their lives who's experienced dementia or cognitive impairment, so they have a good understanding of the stakes and the ripple effects a disease like dementia really has for your entire life and anyone who loves you. And so I love that people are taking a real interest in investing in long-term brain health and wanting to prevent dementia, wanting to do everything they can in their power. And it turns out there's a lot in your power to keep cognitive impairment at bay. But that leads me to something I really want to talk about today, which is Alzheimer's blood tests. More and more people are so interested in these tests, and I completely understand why. I'm all for dementia prevention. But I do think that these tests are really not for everyone. They give us limited information. They're useful in very specific circumstances, but they're not for the average person interested in protecting their brain health. And I want to break down why, because I think if you take this test for the wrong reasons in the wrong set of circumstances, you could end up getting a result that's really disruptive for your life, that causes an incredible amount of stress and burden, and we don't really even know what to do with it. So let me take it from the top. Why are people excited about blood tests for Alzheimer's disease in the first place? And the reason that this is such an important advancement for patient care and for neurology research is because for years until now, the only way we had to diagnose Alzheimer's was a very lengthy, invasive, and expensive process. Essentially, patients had to be evaluated by a specialist like a neurologist. They had to take written memory tests. They had to undergo invasive spinal taps and maybe advanced brain imaging like PET scans or MRIs. And all of that can really be a burden on a patient financially, and it takes quite a bit of time. So these blood tests are much more accessible, they're cheaper, and they're quicker for diagnosing Alzheimer's disease. And certainly, since we now live in a world where we do have some drugs to treat Alzheimer's, getting that diagnosis quickly is more important than ever. So that's why this is exciting. Now, how do these tests work? Well, the two tests that we have on the market right now look for different versions of tau, which is a protein that forms these abnormal tangles in the brain and can lead to memory loss. One of the tests also measures an abnormal protein called beta-amyloid, which forms these sticky plaques that are a hallmark of Alzheimer's disease and the target of a lot of drugs that have recently been approved to treat Alzheimer's. Now, the key thing to know about these tests is that they can help evaluate patients with early signs of cognitive decline, but they aren't designed to predict Alzheimer's risk in healthy people. That's key. And even if they could predict Alzheimer's risk in healthy people, there are no approved treatments yet to prevent the onset of the disease. So even if you're healthy and we got a result that was concerning, we wouldn't have anything to offer you aside from, hey, here are some healthy lifestyle modifications that we know work for dementia prevention. So getting that test could really be a huge burden emotionally and psychologically, and it could really change your life without much of an upside in terms of intervention that we can offer. I'm going to get into the specifics of each test, but let me first just say up top why these tests aren't perfect. So number one, when healthy patients take these tests and find concerning results, we really have to do a lot of education and counseling because many healthy older adults have buildup of these abnormal amyloid and tau proteins, but not all of them go on to develop Alzheimer's disease. So specifically, roughly 15% of healthy, symptom-free people already have abnormal levels of amyloid in their brains at age 50. And by age 75, that number jumps to more than a third of people and roughly half by age 85. So having a positive test does not necessarily correlate with cognitive impairment or dementia. And that's a really key thing to understand in terms of the limitations of what these tests actually tell us. That means that right now, these tests are most meaningful when they're coupled with clinical signs of dementia. But when they're done in healthy people, we don't know what to make of them because they don't necessarily predict that you're going to develop dementia. Also important to know that even in people who have cognitive decline, right now the guidelines from the American Academy of Neurology and the American Academy of Family Physicians say that you can't rely on these tests alone as a standalone diagnostic test. Your doctor still has to use the result and interpret it in the context of your entire medical picture and potentially other supportive tests in order to make that official diagnosis of Alzheimer's disease. Okay, so now that we've gotten that out of the way, let me break down the two Alzheimer's blood tests that we have. So we have two FDA-cleared blood tests for Alzheimer's disease. They both require a prescription from your doctor, and they're both indicated only for adults 55 and up. The first test is called Lumipulse. Lumipulse measures both tau and amyloid in the blood. And because it measures both of those proteins, it's a little more accurate. The other test is called Elecsys, and it measures another form of tau, and it's designed really only to rule out Alzheimer's disease, not to rule it in. Both of these tests have a great negative predictive value, over 90%, meaning if you get a negative on the test, the likelihood that you truly do not have the disease is very, very high. But indeterminate results occur in about 20 to 30% of cases, depending on which test is used. And so that leaves a lot of people in an uncomfortable gray area. And again, these tests are great for ruling out the disease, but they're not standalone diagnostic tests. So current evidence and guidelines support using these blood tests in specific clinical scenarios. Patients who objectively have cognitive impairment and are undergoing a diagnostic workup because their doctor suspects Alzheimer's disease. Or patients who are being evaluated for their eligibility for drugs to treat Alzheimer's disease. These blood tests tend to be a requirement before you can go ahead and get the infusions of those new drugs, lecanemab and donanemab, for Alzheimer's. These tests may also be used as a triage tool to assess whether or not someone needs more expensive or invasive testing for Alzheimer's, because if the test is negative, you have a good sense that that patient doesn't have Alzheimer's. So it's a good first step before you commit someone to further testing with a spinal tap or advanced brain imaging. These tests, though, are specifically not recommended for asymptomatic individuals. Testing in cognitively unimpaired individuals has been proven to produce false positives and introduce diagnostic uncertainty. So again, blood biomarker testing is not currently recommended for asymptomatic individuals. Why? Because false positives can leave people feeling really distressed and it can change their life, but we don't even know if that positive has any relationship with the likelihood that you will go on to develop signs and symptoms of cognitive impairment or dementia. Also, if you do get a positive, we don't have any evidence to support treating you with any medicines as of yet. This is an active area of research that could change, but today, right now, we don't have any evidence for using drugs to prevent Alzheimer's in asymptomatic people. There's also an important ethical consideration that I talk about with my patients a lot, and that's the discrimination risk. There's been no sort of legal standard discussed in terms of what these results mean for you when it comes to employment discrimination and insurance discrimination. So you do leave yourself vulnerable to that kind of thing if you take this test. And the bottom line here is that pre-test counseling is absolutely essential. An informed discussion with your doctor when it comes to these tests is absolutely everything. Before you get this test done, you should understand what its limitations are, why it's being done for you, what the results could possibly mean for you as an individual, and the potential for stigma or discrimination for you before you go ahead and get those tests done. You want to make sure that it's going to be worth it for you. Remember, there's a lot we have in our power to prevent dementia, mostly in optimizing your medical health and developing lifestyle strategies for healthy brain health long-term as you age. But we don't have any prescription treatments for dementia prevention right now. Now, in the future, that could change. In the future, tests like these could become a routine part of your preventative checkups, things to look for your risk for dementia. But right now, we don't have a good enough understanding of the results of these tests and how to act on those results to roll them out to the masses as a preventative measure. It's just way too dangerous with no upside. In the future, I'm excited to see how that will change. But right now, the best thing you can do if you're interested in preventing dementia is talk to your doctor about what your unique risk factors are and how they should be addressed.